Historically, direct visualization of the bubble was the only measure to evaluate the colon, but the virtual colonoscopy is now available, and virtual colonoscopy provides the computer simulated view of the air-filled distended colon using a conventional CT scanning. So we will see about the colonoscopy. What is colonoscopy? So the colonoscopy is a procedure in which a doctor uses a colonoscope. It's a type of scope to look inside the rectum and colon. And the colonoscopy can show irritated and swollen tissue, any ulcers, polyps, and cancer. And here we can visualize the sigmoid transcending and ascending colon. It is possible to means the flexible fiber optic colonoscope. This scope have the same capabilities of those used for EGD, but this will be little larger in diameter and longer. And the video recordings can be used in the document of the procedure and findings. Coming to the indication, the first one, investigate intestinal signs and symptoms. So the colonoscopy can help the doctor to explore any possible causes of abdominal pain, rectal bleeding, any chronic diarrhea continuously for a long time, or any other intestinal problems. And even it can help to screen for colon cancer. So the people those who are crossed above 45 or older, they are at the greater risk of developing colon cancer and have no colon cancer risk factors than age, that even the patient may know if they are not having colon cancer, it is better to undergo colonoscopy for every 10 years. And if any other risk factors present, the doctor may recommend to screen sooner. And the colonoscopy is one of the few options for colon cancer screening. And look for more polyp. If patient has any polyp before, doctor may recommend to follow colonoscopy to look for, and in case if they want to remove any additional polyp, we can ask them to undergo the colonoscopy. And treat an issue. Sometimes the colonoscopy may be done for any treatment purposes. In case if you want to place a stent or remove an object in the colon, also we can use the colonoscopy. What are the risk factors? So rarely complications of colonoscopy also may include a reaction to the sedative used during examination and the bleeding from the site where a tissue biopsy we have taken, and sometimes there may be a chance of perforation in the colon or rectum wall. How we have to prepare the patient for colonoscopy? So before the colonoscopy, we have to empty the colon. So any residue in the colon make it difficult. So if there is anything kept in the colon, it will be very difficult to view the colon and the rectum during the examination. So the first and the foremost thing we have to do, that is follow a special diet the day before the exam. So typically the patient won't be able to eat solid food day before the exam. So clear liquids we can advise them to have, that is plain water, tea and coffee without a milk or cream, broth and carbonated beverages. And better we should insist the patient to avoid red liquids, because what will happen, it will be when you are taking the colonoscopy, we may be mistaken as it is blood. So patient will not be able to eat or drink anything after midnight. So after 12 o'clock. Take a laxative. So doctor will usually recommend taking a prescription laxative, usually in a large volume, and it can be either a pill form or a liquid form. And in some cases, the patient will be instructed to take laxative in the night time before the colonoscopy, and even they can take the laxative both the night and the morning before the procedure. The we have to make them to adjust the medication. If the patient is on diabetes, hypertension, heart problem, and they are taking any anti-epileptic drugs or any iron supplement, all the medicine should be skipped off. happen during the procedure. So this procedure is used commonly as a diagnostic and a screening device and is most frequently used for cancer screening and for surveillance in patients with the previous colon cancer or polyp. And this during a colonoscopy, we will ask the patient to wear a gown, but sedation of anesthesia will be recommended. And some cases, if the patient is not sedated, we can give some pain medication directly to IV to less the discomfort. And at the time of examination, we will make them to lie on the side on the exam table, usually the knees drawn toward the chest, so that it will be easy to visualize the colon and the rectum. And the scope, if you are seeing the scope, it is long enough to reach the colon, and it is the tip of it, it will be having a light and allows the doctor to pump air, carbon dioxide or water into the colon. And what it does actually, this air and carbon dioxide, it will be inflating the colon. And so if once the colon is getting inflated, it will provide a better view to visualize the lining of the colon. And when the scope is moved or air is introduced, sometimes the patient may feel stomach cramping or urge to have a bowel movement. So they should be explained prior to the procedure. And the colonoscope also contains a tiny video camera. So whatever the things we are visualizing, everything will be recorded as a part of documentation. And the camera sends images to the external monitors so that it will be very easy for the doctor to study inside the colon. And even the doctor also insert instruments through the channel to take tissue samples in case if you want to rule out something, or even it can be done as a part of treatment procedure to remove polyp or other areas of abnormal tissue. And usually the colonoscopy takes about 30 to 60 minutes. So what we do after the procedure? So after the procedure, it takes about an hour to begin recover from the sedative. So we can make the patient to be at the table, and they need some time to take to home because they may be having some effect of the sedation. And mainly we should insist the patient, always the patient should have someone bystander. The patient himself or herself should not drive, or they are not advised to take any decisions or work. They need a rest. And even the patient may feel bloated or pass gas for a few hours after the exam as they clear the air from colon. So we can make them to walk to relieve any discomfort. And sometimes what will happen, the patient may notice a small amount of blood with the first bowel movement after the colonoscopy. That is a common, and we should insist the patient it's not cause for any complication. And one thing we have to insist, if they are passing continuous blood in the stool, it should be noticed to the doctor. And while unlikely this may occur immediately or the first few days after the procedure, or may be delayed for up to 1 to 2 weeks. The negative result. The colonoscopy is considered negative if the doctor does not find any abnormalities in the colon, but the doctor may recommend if they need any another colonoscopy. And the positive result, the colonoscopy is considered positive if the doctor finds any polyp or abnormal tissue in the colon. And it doesn't mean that all polyps are cancerous. So, and sometimes it may be cancerous, and sometimes it may be precancerous. And if they are removing any polyp at the time of colonoscopy, better it should send for cytological examination to rule out whether it's a cancerous or a precancerous or a non-cancerous. And depending on the size and number of polyp, patient may need to follow more rigorous surveillance schedule in the future, look for more polyp. And if the doctor finds one or two polyp less than 0.4 inch, that is 1 centimeter in diameter, They may ask to recommend a repeat colonoscopy in 7 to 10 years, depending on other risk factors to rule out colon cancer. Thank you.